healthy life with diabetes, and that is the message. You can live a healthy life with this condition. So it doesn't mean that because you have diabetes, it's death sentence. You can have diabetes and live for another 30, 40, 50 years as the case may be. You can have hypertension and live for 40, 50 years as the case may be. Depending on how compliant you are with your medical care. You need to change your lifestyle. You need to do regular exercise and dietary changes. Once you do all this, the things that will give you better outlook or better prognosis, and you monitor your blood sugar regularly. Let me give you a story here again. You know, some of us, human beings can be very terrible. Or how can somebody be deceitful to himself or herself? You know, when you do certain things, you think the doctor will not know. Most times we pick all those things, but at times you just... Now, you are diabetic. You are not taking your drugs. What are you doing? Is it me? The day of your appointment, if your appointment is on Monday, tomorrow for instance, on Saturday you start taking your drug. You take it on Saturday, you take it on Sunday, so that when you get to the doctor on Monday, say, the blood sugar is controlled. Are you deceiving the doctor or you are deceiving yourself? You are deceiving yourself. But however, their medicine has been advanced in such a way that, and we know whether you are taking your drugs. I'll just recommend you to go and do one test. We call it glycated hemoglobin. When you do your glycated hemoglobin, it will tell me, you know, hemoglobin is contained in red blood cell. It's responsible for transporting oxygen and everything in the body. Glucose has the ability of what? Binding to hemoglobin. So if you have not been taking your drugs, almost all the hemoglobin cells will have glucose. It will be, glucose will bind everywhere. So we look at a level. So if I say go and do glycated hemoglobin, so that glycated hemoglobin will give me information about your blood glucose level for the past 2 to 3 months. So once you do your glycated hemoglobin, it's greater than 7%. I know that you are not taking your drug, despite the fact that your blood sugar is controlled at the time you are presenting. So these are the things people do. I'm going to see the doctor, they start taking their drugs. So, but I say go and do. The reason is simple. At the time you now come for follow-up, I'm seeing symptoms that I should not see. I'm seeing things that you know, but your blood glucose is normal. I know that something is wrong. So I'll just say go and do this test. So once a large proportion, a large percentage of hemoglobin is binding glucose, it's an indication that you are not taking your drug. So it's one of the ways. So you can see that you are trying to perfect, let me use the word, irresponsibility. The professional is still trying to still help you. You can now say, Madam or God, though your blood sugar is controlled, but to you, look, see your glycated hemoglobin level, it shows you are not taking your drugs. And with what you are presenting, you are already having this, you are already having that. So what are the challenges in the management of DM? And this applies to several other disease conditions we have. One is acceptability. Acceptability. You have a disease condition which you do not know. You are told you have it. You say, God forbid. You are told you have high blood pressure. You say, God forbid. So what does that translate to? Once you do not accept, it means that you are not going to take actions. You're not going to take action, and the thing continues.